Medical Assistant Exam Crash Course. Question 1. After confirming the patient's identity, a small blood spill occurs on an exam room floor while maintaining privacy. Which action should be included? Option A. Clean it with a dry tissue only. Option B. Wear appropriate PPE and disinfect according to bloodborne pathogen policy. Option C. Ask a visitor to wipe it up. Option D. Cover it with paper and leave it for housekeeping tomorrow. The correct answer is option B. Wear appropriate PPE and disinfect according to bloodborne pathogen policy. Blood spills require PPE and approved disinfection because they may contain bloodborne pathogens. Dry wiping, delegating to visitors, or delaying cleanup leaves an exposure hazard. Question 2. During a certification-style scenario, a patient scheduled for a procedure is involved when an employee is assigned to duties with potential blood exposure for a patient scheduled for a procedure. Which training is required by safety standards? Option A. Bloodborne pathogen training with exposure control procedures. Option B. Retail cashier training only. Option C. Restaurant menu training. Option D. Real estate licensing training. The correct answer is option A. Bloodborne pathogen training with exposure control procedures. Bloodborne pathogen training teaches exposure risks, protective practices, and post-exposure steps for healthcare workers. The other trainings do not address occupational exposure to blood or body fluids. Question 3. During a skills check, the scenario states that the provider blocks lunch, meetings, and procedure times before booking patients after the patient asks a follow-up question. Which scheduling method is being used? Option A. Matrix scheduling. Option B. Sterile scheduling only. Option C. Random scheduling. Option D. Biohazard scheduling. The correct answer is option A. Matrix scheduling. Matrix scheduling blocks unavailable or reserved times so appointments are not placed there. Random, biohazard, and sterile scheduling are not standard appointment scheduling methods. Question 4. At the front desk handoff, a fasting glucose specimen is being collected for a patient with limited mobility. Which tube additive is commonly associated with glucose preservation? Option A. Sodium fluoride in a gray top tube. Option B. Sodium citrate in a light blue tube. Option C. EDTA in a lavender tube. Option D. No additive in a culture bottle. The correct answer is option A. Sodium fluoride in a gray top tube. Gray top tubes commonly contain fluoride to help preserve glucose by inhibiting glycolysis. EDTA, citrate, and culture bottles serve different testing purposes and are not the usual glucose-preserving choice. Question 5. During a skills check, the scenario states that venipuncture is being performed in the antecubital area while working under provider supervision. Which insertion technique is generally appropriate? Option A. Insert parallel under the skin for several inches. Option B. Insert the needle bevel up at about a 15 to 30 degree angle. Option C. Insert bevel down at a 90 degree angle. Option D. Insert through the vein and redirect repeatedly. The correct answer is option B. Insert the needle bevel up at about a 15 to 30 degree angle. A bevel up 15 to 30 degree approach helps enter the vein safely during routine venipuncture. Steep angles, long shallow tunneling, and repeated redirection increase discomfort and complication risk. Question 6. A medical assistant reviews a case where a blood specimen arrives hemolyzed after collection for a patient scheduled for a procedure. Which practice helps prevent this problem? Option A. Force blood through a small needle into the tube. Option B. Shake tubes vigorously to mix faster. Option C. Gently invert tubes according to additive requirements. Option D. Use excessive suction on fragile veins. The correct answer is option C. Gently invert tubes according to additive requirements. Gentle inversion mixes additives without damaging red blood cells. Vigorous shaking, excessive suction, and forcing blood through narrow equipment can rupture cells and cause hemolysis. Question 7. While rooming a patient with limited mobility is involved when an AED is available for an unresponsive patient with no normal breathing. Which action is appropriate? Option A. Place the pads over thick clothing. Option B. Turn on the AED and follow its prompts while continuing emergency response. Option C. Ignore the AED because it gives instructions. Option D. Use the AED only after the clinic closes. The correct answer is option B. Turn on the AED and follow its prompts while continuing emergency response. AEDs are designed to guide rescuers through pad placement and rhythm analysis during cardiac arrest response. Pads over clothing, unnecessary delays, or ignoring available prompts can reduce effectiveness. Question 8. For a patient in the exam room in an outpatient setting, a urine culture is ordered for a patient with possible infection while working under provider supervision. Which instruction is appropriate? Option A. Clean the area and collect a midstream specimen in the sterile container. Option B. Collect from the toilet bowl after voiding. Option C. Fill the container with water before collecting urine. Option D. Touch the inside of the lid to keep it nearby. The correct answer is option A. Clean the area and collect a midstream specimen in the sterile container. A clean catch midstream technique reduces contamination for culture results. Touching sterile surfaces, collecting from the toilet, or adding water can contaminate or dilute the specimen. Question 9. During a certification-style scenario, an older adult is involved when a point-of-care test control result is outside the acceptable range for an older adult. Which action should occur before testing patients? Option A. Do not report patient results until the control problem is resolved. Option B. Throw away the control log. Option C. Continue testing because controls are optional. Option D. Change patient results to match expectations. The correct answer is option A. Do not report patient results until the control problem is resolved. Out-of-range controls indicate the test system may not be reliable, so patient testing should pause until corrected. Ignoring controls, altering results, or discarding records undermines patient safety and compliance. Question 10. At a preventive care appointment, a urine specimen cannot be tested promptly. Which action preserves specimen quality according to policy? Option A. Place it near a sunny window to keep warm. Option B. Mix it with another patient's specimen. Option C. Refrigerate or preserve it if testing is delayed beyond the allowed time. Option D. Leave it uncapped at room temperature all day. The correct answer is option C. Refrigerate or preserve it if testing is delayed beyond the allowed time. Delayed urine testing can allow bacterial growth or chemical changes, so refrigeration or preservatives may be required. Leaving it uncapped, warming it, or mixing specimens compromises results and patient identification. Question 11. While following clinic policy, the medical assistant notes that a finger stick specimen is being collected while working under provider supervision. Which step is commonly performed after puncture? Option A. Touch the collection device to the skin surface repeatedly. Option B. Wipe away the first drop of blood if required by the test procedure. Option C. Bandage before collecting the specimen. Option D. Squeeze the finger forcefully until tissue fluid appears. The correct answer is option B. Wipe away the first drop of blood if required by the test procedure. Many capillary procedures call for wiping the first drop because it may contain tissue fluid or contaminants. Excessive squeezing, scraping the skin, or bandaging before collection can compromise the specimen. Question 12. Before the provider enters the room, a patient has low hemoglobin and complains of fatigue for an adult patient. Which condition is being described? Option A. Dermatophyte infection. Option B. Appendicitis. Option C. Anemia. Option D. Hypertension. The correct answer is option C. Anemia. Anemia involves reduced hemoglobin or red blood cell capacity and can cause fatigue or weakness. Appendicitis, hypertension, and fungal skin infection do not describe low hemoglobin. Question 13. For a patient with hypertension in an outpatient setting, blood cultures are being collected. Which step is especially important? Option A. Palpate the site again with an unclean glove after cleaning. Option B. Use proper skin antisepsis and avoid contaminating the cleaned site. Option C. Draw through visibly dirty skin. Option D. Skip antisepsis because culture bottles contain additives. The correct answer is option B. Use proper skin antisepsis and avoid contaminating the cleaned site. Blood cultures are highly sensitive to contamination, so skin antisepsis and maintaining the cleaned field are critical. Touching the site again, skipping antisepsis, or drawing through dirty skin can cause false positive results. Question 14. For a patient who appears anxious in an outpatient setting, a labeled blood specimen is being sent to the laboratory during a realistic certification question. Which packaging is appropriate? Option A, carry it open in a coat pocket. Option B, place the specimen in a leak-resistant biohazard transport bag with paperwork separated as required. Option C, tape it to the outside of the requisition. Option D, put it loose in the regular mail bin. The correct answer is option B. Place the specimen in a leak-resistant biohazard transport bag with paperwork separated as required. Biohazard transport bags help contain leaks and keep paperwork protected from contamination. Pockets, taped tubes, and loose mail bin transport create exposure and specimen handling risks. Question 15. After confirming the patient's identity, a 12-lead EKG is being set up for a patient asking for clarification. Where is lead V1 placed? Option A, second intercostal space at the left midclavicular line. Option B, fourth intercostal space at the right sternal border. Option C, fifth intercostal space at the left anterior axillary line. Option D, on the right wrist beside the limb lead. The correct answer is option B, fourth intercostal space at the right sternal border. V1 is placed at the fourth intercostal space on the right sternal border. The other locations correspond to different chest or limb areas and would distort the tracing if used for V1. Question 16. A provider asks for assistance because a medical assistant is locating the V4 chest lead. Which landmark is correct? Option A, second rib at the right axillary line. Option B, fourth intercostal space at the right sternal border. Option C, fifth intercostal space at the left midclavicular line. Option D, left wrist below the thumb. The correct answer is option C, fifth intercostal space at the left midclavicular line. V4 is placed in the fifth intercostal space at the left midclavicular line. The other choices describe V1, a limb lead area, or an incorrect thoracic location. Question 17. A provider asks for assistance because a patient pays a fixed amount at each office visit under the insurance plan while preventing documentation errors. Which term describes this payment? Option A, copayment. Option B, premium refund. Option C, deductible only. Option D, relative value unit. The correct answer is option A, copayment. A copayment is a fixed patient payment due for a covered service. A deductible, premium refund, and relative value unit describe other financial or coding concepts. Question 18. While following clinic policy, the medical assistant notes that a patient is going home with a Holter monitor for a returning patient. Which instruction is important? Option A, avoid writing down chest discomfort. Option B, keep a diary of symptoms and activities during monitoring. Option C, remove the electrodes whenever symptoms occur. Option D, take a shower with the monitor unless told otherwise. The correct answer is option B, keep a diary of symptoms and activities during monitoring. A symptom and activity diary helps correlate patient experiences with recorded heart rhythm data. Removing electrodes, getting the device weighed against instructions, or failing to note symptoms reduces the usefulness of the test. Question 19. During a skills check, the scenario states that a regular EKG rhythm has 4 large boxes between our waves. Which approximate heart rate is calculated using the 300 method? Option A, 75 beats per minute. Option B, 40 beats per minute. Option C, 120 beats per minute. Option D, 300 beats per minute. The correct answer is option A, 75 beats per minute. For a regular rhythm, dividing 300 by the number of large boxes gives an estimate, so 300 divided by 4 equals 75. The other values do not match the 300 method for 4 large boxes. Question 20. During a skills check, the scenario states that a 12-lead EKG requires limb electrodes before the patient leaves the clinic. Which label belongs on the right arm area? Option A, LA. Option B, LL. Option C, RA. Option D, V4. The correct answer is option C, RA. RA identifies the right arm limb electrode location. LA and LL refer to other limb leads, while V4 is a chest lead rather than a right arm label. Question 21. For a patient scheduled for a procedure in an outpatient setting, the EKG pattern looks unusual and limb lead placement may have been reversed for a patient scheduled for a procedure. Which action is appropriate? Option A, remove the patient's identification label. Option B, submit it without comment because lead placement never matters. Option C, check lead placement before repeating or submitting the tracing. Option D, change the printed rhythm interpretation manually. The correct answer is option C, check lead placement before repeating or submitting the tracing. Incorrect lead placement can produce misleading tracings, so verifying lead location is part of quality practice. Submitting without checking, removing identification, or altering interpretation manually is unsafe. Question 22. At a provider-requested assessment, a medication note refers to hypotension. What does hypo mean? Option A, below normal or low. Option B, between ribs. Option C, above normal. Option D, before birth. The correct answer is option A, below normal or low. Hypo means low or below normal, so hypotension means low blood pressure. Above normal, between ribs, and before birth use different prefixes. Question 23. After confirming the patient's identity, a patient is scheduled for an antibiotic injection after reviewing the order. Which step is essential before administration? Option A, give half the dose without checking. Option B, ask only whether the patient likes injections. Option C, ask about allergies and check the record for documented reactions. Option D, assume no allergy if the patient is young. The correct answer is option C, ask about allergies and check the record for documented reactions. Medication allergies must be assessed before administration because reactions can be serious. Age, arbitrary dose changes, or preferences about injections do not replace allergy verification. Question 24. After confirming the patient's identity, a medication is ordered by the subcutaneous route for a returning patient. Where is the medication intended to be placed? Option A, into the outer layer of bone. Option B, into the fatty tissue beneath the skin. Option C, into the spinal canal. Option D, directly into a vein. The correct answer is option B, into the fatty tissue beneath the skin. Subcutaneous injections deliver medication into the tissue layer beneath the skin and above muscle. Intravenous, bone, and spinal routes are different procedures with different risks and training requirements. Question 25. For a pediatric patient in an outpatient setting, a patient brings several prescription bottles to a visit. What is the purpose of medication reconciliation? Option A, replace the provider's medication review. Option B, compare all current medications to identify omissions, duplications, or interactions. Option C, throw away medications that look old without asking. Option D, record only medications purchased at the clinic. The correct answer is option B, compare all current medications to identify omissions, duplications, or interactions. Medication reconciliation creates an accurate medication list and helps identify potential safety concerns. Discarding medications, replacing the provider's role, or omitting outside prescriptions can create incomplete information. Question 26. After confirming the patient's identity, a patient says they cannot swallow tablets safely while preventing documentation errors. Which action is appropriate before giving an oral medication? Option A, notify the provider and follow instructions before altering the medication. Option B, crush every tablet automatically. Option C, hide the tablet in food without consent. Option D, tell the patient to swallow it dry. The correct answer is option A, notify the provider and follow instructions before altering the medication. Some tablets should not be crushed or altered, so the provider or pharmacist guidance is needed. Automatic crushing, dry swallowing, or hiding medication can create safety and consent problems. Question 27. In a medical assistant certification review scenario, paper charts are filed alphabetically for a patient waiting for the provider. Which name is usually used first? Option A, street number only. Option B, favorite color. Option C, patient's last name. Option D, appointment room number. The correct answer is option C, patient's last name. Alphabetic filing generally starts with the patient's last name to maintain consistent record organization. Color preferences, street numbers, and room numbers do not provide reliable alphabetic indexing. Question 28. At the front desk handoff, an older adult is involved when a patient uses an albuterol inhaler for wheezing. What is the intended effect? Option A, lower cholesterol over months. Option B, increase blood clotting. Option C, destroy bacteria in the stomach. Option D, relax airway smooth muscle to improve airflow. The correct answer is option D, Relax airway smooth muscle to improve airflow. Albuterol is a bronchodilator that opens airways and can relieve bronchospasm. Blood clotting, cholesterol control, and bacterial destruction are unrelated medication effects. Question 29. When preparing safe patient care, a controlled medication is stored in the clinic before the patient leaves the clinic. Which practice supports accountability? Option A. Let patients sign it out themselves. Option B. Document receipt, administration, waste, and remaining count according to policy. Option C. Keep it unlocked for convenience. Option D. Estimate the count once a year. The correct answer is option B. Document receipt, administration, waste, and remaining count according to policy. Controlled substances require strict documentation and secure handling to prevent diversion and errors. Unlocked storage, infrequent estimates, or patient self-checkout would break accountability requirements. Question 30. While following clinic policy, the medical assistant notes that a patient takes several products for cold symptoms and pain for a patient with limited mobility. Which concern should be reviewed with acetaminophen? Option A. Accidental duplicate dosing can increase liver injury risk. Option B. It replaces all vaccines. Option C. It always causes bacterial resistance. Option D. It should be taken only by injection. The correct answer is option A. Accidental duplicate dosing can increase liver injury risk. Many over-the-counter products contain acetaminophen, so duplicate dosing can exceed safe daily limits and harm the liver. It does not cause antibiotic resistance, replace vaccines, or require injection use. Question 31. When preparing safe patient care, a 12-lead EKG requires limb electrodes after confirming office policy. Which label belongs on the right arm area? Option A, V4. Option B, RA. Option C, LL. Option D, LA. The correct answer is option B, RA. RA identifies the right arm limb electrode location. LA and LL refer to other limb leads, while V4 is a chest lead rather than a right arm label. Question 32. When preparing safe patient care, a vaccine is administered in the clinic for a new patient. Which detail should be documented? Option A. A guess at the manufacturer if the label is missing. Option B. Only the patient's favorite pharmacy. Option C. The weather outside the clinic. Option D. Vaccine name, lot number, expiration date, site, route, and patient response is required. The correct answer is option D. Vaccine name, lot number, expiration date, site, route, and patient response is required. Vaccine documentation supports traceability, safety monitoring, and legal requirements. Pharmacy preference, weather, and guest manufacturer details do not replace required vaccine records. Question 33. After confirming the patient's identity, a pulse rate is documented as tachycardic after noticing a potential safety concern. Which finding is being described? Option A, faster than normal heart rate. Option B, slow breathing only. Option C, low body temperature. Option D, inflammation of the stomach. The correct answer is option A, faster than normal heart rate. Tachycardia describes an abnormally fast heart rate for the patient's situation. Low temperature, slow respirations, and stomach inflammation are different concepts. Question 34. After confirming the patient's identity, a diabetic patient is shaky, sweating, and confused before lunch for a patient with limited mobility. Which condition should be considered? Option A, otitis media. Option B, hyperopia. Option C, hypoglycemia. Option D, dermatitis only. The correct answer is option C, hypoglycemia. Shaking, sweating, and confusion can occur with low blood glucose, especially when meals are delayed. Vision farsightedness, middle ear infection, and skin inflammation do not best match this symptom pattern. Question 35. During a certification-style scenario, a box of supplies must be lifted from the floor. Which technique helps prevent injury? Option A, bend at the knees and keep the load close to the body. Option B, twist at the waist while lifting. Option C, hold the box far away from the body. Option D, lock the knees and lift with the back. The correct answer is option A, bend at the knees and keep the load close to the body. Using the legs and keeping the load close reduces strain on the back. Twisting, holding weight away, and lifting with locked knees increase risk of musculoskeletal injury. Question 36. When preparing safe patient care, a patient asks what the kidneys do during clinical workflow. Which response is accurate? Option A, pump blood through arteries. Option B, exchange oxygen in the alveoli. Option C, filter waste from blood and help regulate fluid balance. Option D, produce bile for fat digestion. The correct answer is option C, filter waste from blood and help regulate fluid balance. The kidneys filter blood, form urine, and help regulate fluid and electrolyte balance. Bile production, gas exchange, and blood pumping are liver, lung, and heart functions. Question 37. At a pediatric visit, a patient with hypertension is involved when a study question asks about bile production for a patient with hypertension. Which organ is primarily responsible? Option A, liver. Option B, bladder. Option C, adrenal gland. Option D, appendix. The correct answer is option A, liver. The liver produces bile, which helps with fat digestion after storage and release through the biliary system. The appendix, bladder, and adrenal gland have different roles. Question 38. While following clinic policy, the medical assistant notes that a medication note refers to hypotension. What does hypo mean? Option A, between ribs. Option B, above normal. Option C, before birth. Option D, below normal or low. The correct answer is option D, below normal or low. Hypo means low or below normal, so hypotension means low blood pressure. Above normal, between ribs, and before birth use different prefixes. Question 39. During a follow-up visit, a patient describes dysuria after the patient asks a follow-up question. What does dys usually indicate? Option A, after meals. Option B, without. Option C, difficult or painful. Option D, normal. The correct answer is option C, difficult or painful. Dys often means difficult, painful, or abnormal, so dysuria is painful or difficult urination. Normal, without, and after meals are represented by different word parts. Question 40. When preparing safe patient care, a medical office submits a professional paper claim for a patient asking for clarification. Which form is traditionally used? Option A, fire extinguisher tag. Option B, W-4 tax withholding form. Option C, CMS 1500. Option D, growth chart. The correct answer is option C, CMS 1500. The CMS 1500 is the standard paper professional claim form. Tax, safety, and growth documents are unrelated to claim submission. Question 41. For a patient who appears anxious in an outpatient setting, an anatomy diagram divides the body into left and right portions. Which plane is shown? Option A, transverse plane. Option B, sagittal plane. Option C, oblique medication route. Option D, frontal plane. The correct answer is option B, sagittal plane. The sagittal plane divides the body into left and right portions. Transverse divides upper and lower, frontal divides front and back, and oblique medication route is not an anatomical plane. Question 42. When preparing safe patient care, a patient is lying face down on the exam table while communicating with the care team. Which term describes this position? Option A, Fowler. Option B, supine. Option C, Trendelenburg. Option D, a prone. The correct answer is option D, prone. Prone means lying face down. Supine is face up. Fowler is seated with the head elevated, and Trendelenburg positions the head lower than the feet. Question 43. Before the provider enters the room, an adult patient is involved when a patient has fatigue, cold intolerance, and weight gain with low thyroid activity for an adult patient. Which condition is suggested? Option A, hyperventilation. Option B, hypothyroidism. Option C, otitis media. Option D, tachycardia only. The correct answer is option B, hypothyroidism. Hypothyroidism reflects reduced thyroid hormone activity and can slow metabolism. Hyperventilation, middle ear infection, and fast heart rate do not match the low thyroid pattern described. Question 44. After confirming the patient's identity, a patient has swelling in the ankles from excess fluid in tissues. Which term applies? Option A, edema. Option B, diplopia. Option C, cyanosis. Option D, hematuria. The correct answer is option A, edema. Edema is swelling caused by fluid accumulation in tissues. Cyanosis, hematuria, and diplopia refer to bluish discoloration, blood in urine, and double vision. Question 45. While following clinic policy, the medical assistant notes that an exam table is cleaned between patients after routine use during a quality control check. Which term describes reducing many pathogens on a surface? Option A, apical measurement. Option B, venipuncture. Option C, transcription. Option D, disinfection. The correct answer is option D, disinfection. Disinfection reduces many disease-causing organisms on surfaces and is appropriate for many non-critical items. Apical measurement, venipuncture, and transcription are unrelated clinical or administrative tasks. Question 46. A provider asks for assistance because a patient's insurance requires approval to see a specialist for a patient with a routine complaint. Which document or process may be needed? Option A, referral. Option B, medication lot sticker. Option C, inventory count sheet. Option D, autoclave log only. The correct answer is option A, referral. A referral authorizes or documents the need for specialty care under many insurance plans. Inventory sheets, sterilization logs, and lot stickers do not authorize specialty visits. Question 47. During a clinical skills check, a patient pays a fixed amount at each office visit under the insurance plan. Which term describes this payment? Option A, premium refund. Option B, copayment. Option C, relative value unit. Option D, deductible only. The correct answer is option B, copayment. A copayment is a fixed patient payment due for a covered service. A deductible, premium refund, and relative value unit describe other financial or coding concepts. Question 48. During a skills check, the scenario states that an insurance plan pays 80% and the patient is responsible for 20% after the deductible while supporting safe patient care. Which term describes the patient portion? Option A, sterilization. Option B, chief complaint. Option C, coinsurance. Option D, capitation only. The correct answer is option C, coinsurance. Coinsurance is a percentage share of allowed costs paid by the patient. Chief complaint, capitation, and sterilization describe different clinical or payment concepts. Question 49. When preparing safe patient care, a claim needs a code for an office procedure performed by the provider for a patient in the exam room. Which code set is commonly used? Option A, Advanced Directive. Option B, CPT. Option C, YCD-10-CM. Option D, Alphabetic Filing. The correct answer is option B, CPT. CPT codes describe medical procedures and services for billing. ICD-10-CM diagnoses, filing systems, and advanced directives do not code the service performed. Question 50. During a walk-in visit, a patient with limited mobility is involved when Medicare may not cover a service and the patient must be informed before it is performed for a patient with limited mobility. Which form may be needed? Option A, daily appointment reminder card. Option B, blood-borne pathogen log. Option C, the advance beneficiary notice. Option D, pediatric growth chart. The correct answer is option C, advance beneficiary notice. An advance beneficiary notice informs a Medicare patient that a service may not be covered and that they may be financially responsible. Exposure logs, growth charts, and reminder cards do not serve this financial notice purpose. Question 51. When preparing safe patient care, a patient wants lab results through an online system. Which feature supports secure access? Option A, a patient portal with identity verification and secure messaging. Option B, a hallway bulletin board. Option C, a group text to unrelated patients. Option D, a public social media comment. The correct answer is option A, a patient portal with identity verification and secure messaging. A patient portal is designed to give patients secure access to health information and communication. Social posts, bulletin boards, and unrelated group texts expose protected information. Question 52. A medical assistant reviews a case where the provider blocks lunch, meetings, and procedure times before booking patients during clinical workflow. Which scheduling method is being used? Option A, matrix scheduling. Option B, biohazard scheduling. Option C, sterile scheduling only. Option D, a random scheduling. The correct answer is option A, matrix scheduling. Matrix scheduling blocks unavailable or reserved times so appointments are not placed there. Random, biohazard, and sterile scheduling are not standard appointment scheduling methods. Question 53. A provider asks for assistance because a medical assistant reports a patient concern to the provider using SPAR for a teen patient. What does the S represent? Option A, sterilization. Option B, supine. Option C, situation. Option D, superbill. The correct answer is option C, situation. In SPAR, situation introduces the immediate issue being communicated. Sterilization, superbill, and supine are unrelated to the SPAR communication framework. Question 54. When preparing safe patient care, medical supplies have expiration dates. Which inventory method reduces waste? Option A, use the newest supplies first every time. Option B, ignore expiration dates if packaging looks clean. Option C, use first in, first out rotation while checking expiration dates. Option D, hide older supplies behind new boxes. The correct answer is option C, use first in, first out rotation while checking expiration dates. First in, first out rotation helps older usable supplies get used before they expire. Newest first storage, hiding older stock, or ignoring dates increases waste and safety risk. Question 55. When preparing safe patient care, a patient leaves a medication question by phone while following standard precautions. Which information should be documented? Option A, no documentation unless the patient complains. Option B, date, time, caller identity, message details, and action taken. Option C, only the caller's tone of voice. Option D, the assistant's lunch preference. The correct answer is option B, date, time, caller identity, message details, and action taken. Complete telephone documentation creates a clear record of the request and response. Tone alone, irrelevant personal details, or no documentation can lead to missed care and poor continuity. Question 56. A provider asks for assistance because a patient asks the medical assistant to diagnose a rash for a patient in the exam room. Which response is appropriate? Option A, explain that the provider will evaluate the rash and document the patient's concern. Option B, tell the patient no evaluation is needed. Option C, diagnose the rash as cancer. Option D, prescribe a topical steroid. The correct answer is option A, explain that the provider will evaluate the rash and document the patient's concern. Medical assistants collect information and assist with care but do not diagnose or prescribe. Giving a diagnosis, ordering treatment independently, or dismissing the concern exceeds appropriate scope. Question 57. For a patient with diabetes in an outpatient setting, a patient says, I feel pressure in my chest after climbing stairs while supporting safe patient care. How should the information be documented? Option A, document it as a confirmed diagnosis of angina. Option B, record the statement as subjective data in the patient's own words when possible. Option C, leave it out unless the provider hears it directly. Option D, change the wording to make it sound less serious. The correct answer is option B, record the statement as subjective data in the patient's own words when possible. The patient's reported symptom is subjective data and should be documented accurately for the provider's evaluation. Medical assistants should not diagnose, omit relevant symptoms, or soften documentation in a way that changes the meaning. Question 58. While following clinic policy, the medical assistant notes that a staff member needs to discuss lab results with a patient. Which location best protects confidentiality? Option A, the clinic's social media page. Option B, the crowded waiting room. Option C, a private area away from other patients. Option D, a public elevator. The correct answer is option C, a private area away from other patients. Private conversations protect the patient's health information from unnecessary disclosure. Waiting rooms, elevators, and social media are inappropriate places to discuss confidential results. Question 59. During a skills lab scenario, a patient names someone to make healthcare decisions if the patient becomes unable while following standard precautions. Which role is being assigned? Option A, insurance coder. Option B, healthcare proxy or durable power of attorney for healthcare. Option C, sterile processing technician. Option D, collection agency. The correct answer is option B, healthcare proxy or durable power of attorney for healthcare. A healthcare proxy or durable power of attorney for healthcare identifies a decision maker if the patient loses capacity. Coding, sterilization, and collections are unrelated administrative roles. Question 60. In a medical assistant certification review scenario, a patient receives new wound care instructions for a patient with limited mobility. Which method checks understanding? Option A, assume silence means full understanding. Option B, ask only whether the patient owns a phone. Option C, give instructions as quickly as possible and leave. Option D, ask the patient to explain the steps in their own words. The correct answer is option D, ask the patient to explain the steps in their own words. Teach back confirms understanding by having the patient describe the instructions. Phone ownership, rushed teaching, and silence do not verify that the patient can follow the plan. Question 61. While following clinic policy, the medical assistant notes that a patient says they are scared about a biopsy result after noticing a potential safety concern. Which response is therapeutic? Option A, you should not ask questions. Option B, that sounds frightening, I can let the provider know you have concerns. Option C, I know for sure nothing is wrong. Option D, everyone gets scared, so stop worrying. The correct answer is option B, that sounds frightening, I can let the provider know you have concerns. An empathetic response acknowledges feelings and offers appropriate support without giving false reassurance. Dismissing fear, guaranteeing results, or discouraging questions is not therapeutic. Question 62. During a skills check, the scenario states that a medical assistant reports a patient concern to the provider using SPAR for a patient asking for clarification. What does the S represent? Option A, superbill. Option B, sterilization. Option C, supine. Option D, situation. The correct answer is option D, situation. In SPAR, situation introduces the immediate issue being communicated. Sterilization, superbill, and supine are unrelated to the SPAR communication framework. Question 63. At the front desk handoff, a child has injuries that raise reasonable suspicion of abuse. Which action is appropriate? Option A, ignore it because reporting is uncomfortable. Option B, ask the suspected abuser for permission to report. Option C, post pictures online to get opinions. Option D, follow mandatory reporting and office policy immediately. The correct answer is option D, follow mandatory reporting and office policy immediately. Healthcare workers may have mandatory reporting duties when abuse is suspected, depending on law and policy. Ignoring signs, seeking permission from a suspected abuser, or posting information online is unsafe and inappropriate. Question 64. While following clinic policy, the medical assistant notes that an office policy emphasizes avoiding preventable patient harm during clinical workflow. Which ethical principle is involved? Option A, downcoding. Option B, respondeat copying. Option C, non-maleficence. Option D, capitation. The correct answer is option C, non-maleficence. Non-maleficence means avoiding harm and is central to safe healthcare practice. Capitation and downcoding are payment or coding terms, while the third option is not a valid ethical principle. Question 65. When preparing safe patient care, a pulse rate is documented as tachycardic for a pediatric patient. Which finding is being described? Option A, low body temperature. Option B, inflammation of the stomach. Option C, faster than normal heart rate. Option D, slow breathing only. The correct answer is option C, faster than normal heart rate. Tachycardia describes an abnormally fast heart rate for the patient's situation. Low temperature, slow respirations, and stomach inflammation are different concepts. Question 66. While following clinic policy, the medical assistant notes that a patient in the waiting room reports crushing chest pain and sweating during the visit. Which action should the medical assistant take? Option A, tell the patient to drive home and sleep. Option B, ask the patient to wait until the next available routine slot. Option C, activate the office emergency protocol and notify the provider immediately. Option D, offer billing forms before alerting anyone. The correct answer is option C, activate the office emergency protocol and notify the provider immediately. Crushing chest pain with sweating may indicate a medical emergency and requires immediate escalation. Waiting, advising the patient to drive, or focusing on paperwork delays care. Question 67. A provider asks for assistance because a patient begins having a seizure in the exam room for a patient in the exam room. Which action is appropriate? Option A, put fingers in the patient's mouth. Option B, protect the patient from injury and do not restrain movements. Option C, hold the patient down forcefully. Option D, offer food during the seizure. The correct answer is option B, protect the patient from injury and do not restrain movements. Seizure first aid focuses on safety, protecting the head, and allowing the seizure to pass without restraint. Placing objects in the mouth, forceful restraint, or giving food during a seizure can injure the patient. Question 68. While following clinic policy, the medical assistant notes that a patient develops wheezing and facial swelling after a medication. Which response is appropriate? Option A, schedule a routine follow-up in 6 months. Option B, activate emergency protocol and prepare to assist with ordered epinephrine. Option C, offer a glass of water only. Option D, tell the patient to ignore throat symptoms. The correct answer is option B, activate emergency protocol and prepare to assist with ordered epinephrine. Wheezing and facial swelling after medication can indicate anaphylaxis, requiring rapid emergency response. Routine scheduling, ignoring airway symptoms, or offering water alone delays potentially life-saving care. Question 69. During a skills check, the scenario states that a patient is anxious about a procedure while maintaining privacy. Which behavior shows active listening? Option A, interrupt to finish the patient's sentences. Option B, look away and type unrelated notes. Option C, maintain appropriate eye contact and summarize the patient's concern. Option D, tell the patient anxiety is silly. The correct answer is option C, maintain appropriate eye contact and summarize the patient's concern. Active listening uses attention, reflection, and clarification to show the patient was heard. Interrupting, disengaging, or minimizing feelings can increase anxiety and reduce trust. Question 70. For a new patient in an outpatient setting, a patient suddenly has facial drooping and arm weakness for a new patient. Which emergency condition should be suspected? Option A, stroke. Option B, routine nearsightedness. Option C, seasonal allergies only. Option D, simple paperwork fatigue. The correct answer is option A, stroke. Facial drooping and arm weakness are warning signs captured by FAST for possible stroke. Allergies, vision issues, and paperwork fatigue do not match sudden focal neurologic deficits. Question 71. For a patient with hypertension in an outpatient setting, adult CPR is started according to current basic life support guidance. Which compression rate is commonly taught? Option A, 250 to 300 compressions per minute. Option B, 100 to 120 compressions per minute. Option C, 1 compression every 5 minutes. Option D, 10 to 20 compressions per minute. The correct answer is option B, 100 to 120 compressions per minute. Adult CPR training commonly teaches a compression rate of 100 to 120 per minute. Very slow, extremely fast, or occasional compressions do not provide effective circulation support. Question 72. During a skills check, the scenario states that a conscious adult cannot speak or cough effectively while choking after the patient asks a follow-up question. Which first aid action is commonly used? Option A, offer a large meal. Option B, insert a blind finger sweep. Option C, abdominal thrusts according to training. Option D, tell the patient to lie flat and sleep. The correct answer is option C, abdominal thrusts according to training. Severe airway obstruction in a conscious adult is commonly treated with abdominal thrusts by trained responders. Food, lying down, or blind finger sweeps can worsen obstruction or injury. Question 73. After confirming the patient's identity, a patient falls in the hallway and says their hip hurts for a teen patient. Which action is appropriate? Option A, keep the patient still, call for help, and follow incident protocol. Option B, delete the event if no one saw it. Option C, lift the patient quickly without assessment. Option D, tell the patient to walk it off. The correct answer is option A, keep the patient still, call for help, and follow incident protocol. After a fall with pain, the patient should not be moved unnecessarily until assessed and help arrives. Rapid lifting, dismissing the injury, or hiding the event can worsen harm and violate reporting procedures. Question 74. For a patient who appears anxious in an outpatient setting, a staff member needs to discuss lab results with a patient. Which location best protects confidentiality? Option A. The clinic's social media page. Option B. The crowded waiting room. Option C. A public elevator. Option D. A private area away from other patients. The correct answer is option D. A private area away from other patients. Private conversations protect the patient's health information from unnecessary disclosure. Waiting rooms, elevators, and social media are inappropriate places to discuss confidential results. Question 75. During an annual wellness visit, a provider asks the medical assistant to prepare for suture removal while preparing for provider review. Which supply is commonly needed? Option A. A blood pressure cuff only. Option B. A urine culture cup only. Option C. Sterile suture removal scissors or a sterile blade with forceps according to policy. Option D. A meal tray. The correct answer is option C. Sterile suture removal scissors or a sterile blade with forceps according to policy. Suture removal uses appropriate sterile instruments and infection control technique. A cuff, urine cup, or meal tray does not remove sutures safely. Question 76. During a clinical skills check, a patient has a small foreign material exposure in the eye for an older adult. Which action is appropriate before irrigation? Option A. Ignore contact lenses and begin forcefully. Option B. Check the order or protocol and use appropriate solution and protection. Option C. Apply random medication drops without order. Option D. Use a dry cotton swab across the cornea. The correct answer is option B. Check the order or protocol and use appropriate solution and protection. Eye irrigation should follow protocol with correct solution and care to prevent injury. Dry swabbing, unadhered medication, or forceful technique can damage the eye. Question 77. During a morning clinic session, a teen patient is involved when ear irrigation is ordered for cerumen removal before the patient leaves the clinic. Which precaution is important? Option A. Verify the order and screen for contraindications such as ear pain or perforation history. Option B. Proceed even if the patient reports severe ear pain. Option C. Use very hot water to dissolve wax quickly. Option D. Aim forcefully at the eardrum. The correct answer is option A. Verify the order and screen for contraindications such as ear pain or perforation history. Ear irrigation requires appropriate order, temperature, and screening because perforation or infection can make irrigation unsafe. Hot water, forceful aiming, or ignoring pain can injure the patient. Question 78. Before the provider enters the room, a medication is ordered by the subcutaneous route for a teen patient. Where is the medication intended to be placed? Option A. Directly into a vein. Option B. Into the outer layer of bone. Option C. Into the fatty tissue beneath the skin. Option D. Into the spinal canal. The correct answer is option C. Into the fatty tissue beneath the skin. Subcutaneous injections deliver medication into the tissue layer beneath the skin and above muscle. Intravenous, bone, and spinal routes are different procedures with different risks and training requirements. Question 79. When preparing safe patient care, a cold pack is applied for a minor injury as ordered while communicating with the care team. Which safety instruction is important? Option A. Place a barrier between the cold pack and skin and monitor the area. Option B. Use heat at the same time on the same site. Option C. Leave it on for several hours unattended. Option D. Apply ice directly until the skin turns white. The correct answer is option A. Place a barrier between the cold pack and skin and monitor the area. A barrier and monitoring reduce the risk of tissue injury from cold exposure. Direct prolonged ice, unattended use, or combining heat and cold inappropriately can harm the skin. Question 80. At a pediatric visit, a blood pressure reading is being prepared for an adult with a large upper arm for a patient who appears anxious. Which action supports the most accurate result? Option A. Select a cuff with a bladder size appropriate for the arm circumference. Option B. Deflate the cuff as rapidly as possible. Option C. Place the cuff over the sleeve for comfort. Option D. Use the smallest cuff to keep it snug. The correct answer is option A. Select a cuff with a bladder size appropriate for the arm circumference. Correct cuff size keeps the pressure reading closer to the patient's true blood pressure because an undersized cuff can falsely elevate the value. Measuring over clothing, choosing equipment for convenience, or deflating too quickly can distort the reading and lead to poor clinical decisions. Question 81. During a skills lab scenario, a new patient is involved when a patient is scheduled for a minor office procedure while checking the chart. Which role may the medical assistant perform? Option A. Sign the consent for the patient. Option B. Perform the procedure without provider involvement. Option C. Explain all surgical risks independently. Option D. Witness the patient's signature after the provider obtains consent if office policy allows. The correct answer is option D. Witness the patient's signature after the provider obtains consent if office policy allows. Medical assistants may witness signatures according to policy, but the provider explains risks and obtains informed consent. Independent risk counseling, unsupervised procedures, or signing for the patient exceeds the role. Question 82. At a pediatric visit, a pulse oximeter is not giving a steady reading on a patient with cold fingers for a patient who appears anxious. Which action should the medical assistant try first? Option A. Place the probe on a moving hand during conversation. Option B. Ignore the reading because pulse oximetry is optional. Option C. Apply the sensor over dark nail polish without adjustment. Option D. Warm the finger and ensure the sensor is positioned correctly. The correct answer is option D. Warm the finger and ensure the sensor is positioned correctly. Cold extremities and poor sensor placement can interfere with pulse oximeter detection. Nail polish, movement, and ignoring an unstable reading can all lead to inaccurate oxygen saturation documentation. Question 83. While following clinic policy, the medical assistant notes that an infant arrives for a well-child visit. Which measurement is commonly documented in addition to weight and length? Option A. Head circumference. Option B. Peak flow only. Option C. Waist to hip ratio. Option D. Snellen distance score. The correct answer is option A. Head circumference. Head circumference is an important growth measurement for infants and helps monitor development over time. Waist ratios, peak flow values, and Snellen scores are not routine substitutes for infant growth tracking. Question 84. At a pediatric visit, a patient with limited mobility is involved when orthostatic hypotension is suspected after a patient reports dizziness when standing while checking the chart. Which approach is appropriate? Option A. Measure temperature in 3 routes. Option B. Take only a single seated blood pressure. Option C. Measure blood pressure and pulse after position changes according to protocol. Option D. Ask the patient to jog briefly before measuring. The correct answer is option C. Measure blood pressure and pulse after position changes according to protocol. Orthostatic assessment compares blood pressure and pulse across position changes to evaluate a possible drop with standing. A single seated reading, exertion before measurement, or unrelated temperature checks does not assess the suspected problem. Question 85. While following clinic policy, the medical assistant notes that a temperature of 101.8 degrees Fahrenheit is obtained during intake for a returning patient. How should this finding be handled? Option A. Change it to normal if the patient denies illness. Option B. Record that the patient feels feverish without the value. Option C. Document the measured value as objective data and report it according to office protocol. Option D. Wait until the end of the day to mention it. The correct answer is option C. Document the measured value as objective data and report it according to office protocol. A measured temperature is objective data and should be recorded exactly as obtained. Replacing the value with a vague phrase, delaying a report, or changing the result would make the record inaccurate. Question 86. During a skills check, the scenario states that a point-of-care test control result is outside the acceptable range. Which action should occur before testing patients? Option A. Continue testing because controls are optional. Option B. Change patient results to match expectations. Option C. Do not report patient results until the control problem is resolved. Option D. Throw away the control log. The correct answer is option C. Do not report patient results until the control problem is resolved. Out-of-range controls indicate the test system may not be reliable, so patient testing should pause until corrected. Ignoring controls, altering results, or discarding records undermines patient safety and compliance. Question 87. A medical assistant reviews a case where a patient's height is being measured with a stadiometer while following standard precautions. Which action supports accuracy? Option A. Have the patient remove shoes and stand straight with heels positioned properly. Option B. Round every height to the nearest 6 inches. Option C. A measure while the patient is seated in a soft chair. Option D. Ask the patient to estimate the height from memory. The correct answer is option A. Have the patient remove shoes and stand straight with heels positioned properly. Removing shoes and using proper posture on the stadiometer improves measurement accuracy. Sitting in a soft chair, excessive rounding, or relying on memory can produce an inaccurate record. Question 88. During a skills lab scenario, a provider asks for an apical radial pulse comparison for an adult patient. Which method is appropriate? Option A. Subtract blood pressure from pulse rate. Option B. Have 2 staff members count apical and radial pulses at the same time. Option C. Use pulse oximetry only and skip manual counting. Option D. Count radial pulse in the morning and apical pulse later. The correct answer is option B. Have 2 staff members count apical and radial pulses at the same time. An apical radial comparison requires simultaneous counts so a pulse deficit can be identified accurately. Separate timing, unrelated calculations, or relying only on a device does not measure the difference between heartbeats and peripheral pulses. Question 89. A provider asks for assistance because a pulse oximetry reading remains very low after the sensor is repositioned. Which action should the medical assistant take? Option A. Wait until the next appointment to mention it. Option B. Report the persistent abnormal reading promptly according to office protocol. Option C. Delete the result from the record. Option D. Tell the patient the reading is definitely normal. The correct answer is option B. Report the persistent abnormal reading promptly according to office protocol. A persistent abnormal oxygen saturation may signal impaired oxygenation and should be escalated promptly. Deleting results, falsely reassuring the patient, or delaying communication can place the patient at risk. Question 90. A provider asks for assistance because a patient has no known infection listed in the chart while preventing documentation errors. Which infection control approach still applies? Option A. Wear sterile gloves for all administrative tasks. Option B. Skip hand hygiene when the patient appears healthy. Option C. Use airborne isolation for every routine visit. Option D. Use standard precautions for every patient encounter. The correct answer is option D. Use standard precautions for every patient encounter. Standard precautions assume that blood and body fluids may be infectious and apply to every patient. Appearance alone is not a safety guide, while universal airborne isolation or sterile gloves for non-sterile tasks is unnecessary and inefficient. Question 91. A provider asks for assistance because a patient is pale, cool, clammy, and confused after an injury for a patient with diabetes. Which condition is a concern? Option A. Myopia. Option B. Acne. Option C. Glotitis externa. Option D. Shock. The correct answer is option D. Shock. Pale, cool skin, clamminess, and confusion after injury can indicate shock and require urgent response. Nearsightedness, ear canal infection, and acne do not explain this emergency pattern. Question 92. For an older adult in an outpatient setting, a medical assistant experiences a needle stick while cleaning a room. Which action should be taken first? Option A. Apply lotion and continue rooming patients. Option B. Wash the area and report the exposure according to policy. Option C. Hide the injury if bleeding stops. Option D. Finish all remaining tasks before reporting. The correct answer is option B. Wash the area and report the exposure according to policy. Immediate washing and prompt reporting start the post-exposure process and protect the employee. Hiding the injury, delaying reporting, or simply applying lotion can interfere with timely evaluation and follow-up. Question 93. For a patient with diabetes in an outpatient setting, a patient is suspected of having active tuberculosis after confirming office policy. Which precaution is most appropriate? Option A. Use only clean gloves. Option B. Ask the patient to remove any mask to speak clearly. Option C, place the patient in the waiting room until closing. Option D, use airborne precautions with appropriate respiratory protection. The correct answer is option D, use airborne precautions with appropriate respiratory protection. Tuberculosis can spread through airborne particles, so respiratory protection and isolation procedures are needed. Gloves alone, extended waiting room exposure, or removing source control can increase transmission risk. Question 94. During a skills lab scenario, a reusable surgical instrument must be free of all microorganisms including spores for a patient in the exam room. Which process is required? Option A, routine dusting. Option B, sanitization only. Option C, sterilization. Option D, plain water rinsing. The correct answer is option C, sterilization. Sterilization destroys all forms of microbial life including spores when performed correctly. Sanitizing, dusting, or rinsing lowers visible soil or some organisms but does not make an instrument sterile. Question 95. After confirming the patient's identity, a patient requests correction of information in the medical record while maintaining privacy. Which action is appropriate? Option A, tell the patient records can never be reviewed. Option B, erase the original entry without documentation. Option C, change another patient's chart instead. Option D, follow the facility process for an amendment or addendum. The correct answer is option D, follow the facility process for an amendment or addendum. Medical records are corrected through formal amendment or addendum processes that preserve integrity. Erasing entries, refusing all review, or altering the wrong chart is improper. Question 96. A medical assistant reviews a case where smoke is seen near an electrical outlet in the clinic for an adult patient. Which action aligns with the race fire response sequence? Option A, ignore the smoke until flames appear. Option B, open all doors to ventilate smoke. Option C, collect insurance cards before leaving. Option D, rescue patients in immediate danger and activate the alarm according to policy. The correct answer is option D, rescue patients in immediate danger and activate the alarm according to policy. RACE emphasizes rescuing those in danger, activating alarm, containing fire, and extinguishing or evacuating as appropriate. Administrative tasks, opening doors, or ignoring smoke can worsen danger and delay response. Question 97. While following clinic policy, the medical assistant notes that a patient reports a severe latex allergy before rooming during clinical workflow. Which action is appropriate? Option A, use powdered latex gloves for a better fit. Option B, document the allergy only after the visit. Option C, ignore the report unless a rash is visible. Option D, use latex-free supplies and alert the care team. The correct answer is option D, use latex-free supplies and alert the care team. Latex allergy can cause serious reactions, so latex-free supplies and team awareness are important before care begins. Ignoring the report, using latex products, or delaying documentation can expose the patient to harm. Question 98. While following clinic policy, the medical assistant notes that a used venipuncture needle is ready for disposal for a patient scheduled for a procedure. Which practice is safest? Option A, recap with both hands to prevent leakage. Option B, avoid recapping and dispose of it immediately in a sharps container. Option C, place it in a coat pocket until the room is cleaned. Option D, break the needle before disposal. The correct answer is option B, avoid recapping and dispose of it immediately in a sharps container. Avoiding recapping and placing sharps directly into the proper container reduces needle stick risk. Two-handed recapping, breaking needles, or carrying sharps in pockets are unsafe practices. Question 99. While following clinic policy, the medical assistant notes that multiple tubes including blood cultures are ordered during venipuncture during a quality control check. Which specimen is collected first in the standard order of draw? Option A, red serum tube after all additives. Option B, lavender EDTA tube. Option C, the blood cultures. Option D, gray fluoride tube. The correct answer is option C, blood cultures. Blood cultures are collected first to reduce contamination risk before additive tubes are drawn. Drawing EDTA, fluoride, or later serum tubes first can interfere with the proper sequence and specimen integrity. Question 100. While following clinic policy, The medical assistant notes that a complete blood count is ordered for a patient for a pediatric patient. Which tube is most appropriate? Option A, gray fluoride tube. Option B, light blue citrate tube. Option C, lavender EDTA tube. Option D, plain urine cup. The correct answer is option C, lavender EDTA tube. Lavender tubes contain EDTA, which preserves blood cells for hematology testing such as a complete blood count. Citrate, fluoride, and urine containers do not provide the correct specimen type for a CBC.